Hello, today we're going to talk about the male genital system. The first thing I want to do, and the only screenshot I'm going to show from the code book, is to look at some of the annotations I have made and to just make the point. I think it's important when you've got several parts of the system, in this case the male genital system, several parts of the system on the same page, that you make a point of writing beside each procedure which part of the body you're talking about. So under epididymis, incision, epididymis, excision, epididymis. Over here, tunica vaginalis, which is the membranous covering over the testes. Incision, excision, repair. Each time making the point of writing beside them what it is. Then the scrotum, incision, scrotum, excision, scrotum. The next page, it continues. Up at the top, notice the very first one is scrotum repair, but then you go into the vas deferens, and then how those break apart. Spermatic cords down at the bottom, laparoscopy, seminal vesicles, just so you make sure and identify each one, because it's easy when there's so many on a page to get those confused. That's all I wanted to show you in the code book for this lecture. Everything else will be the PowerPoint slides, and I'm going to be highlighting the male genital system that are covered in the code book. And only a few things are covered in this part of the body in the textbook. One is the removal of lesions, because I think that's fairly common. I've identified a few here, and note that the code selection is determined by the method of removal, whether it be cryosurgery or however they do it. It's important when you're reading your report, your operative report or your doctor's report, that you note how it's worded, because if it is a subcutaneous lesion, for example, that's going to be in the integumentary system instead of in the genital system. So I have that same point made here, that you just have to read your operative report to see where the doctor is removing the lesions, and if it's considered a subcutaneous lesion, that is going to be in the integumentary system. A couple of procedures are talked about in the textbook. One is a prostatectomy, and it is differentiated by its approach, whether it be transurethral, which is the most common, also referred to as a TURP, which a scope is inserted through the urethra. Trans means through or within, so transurethra. The doctor's getting to the prostate through the urethra using the scope, and once they get into the prostate, they remove tissue small amounts at a time through the scope. A retropubic is an incision in the front wall of the abdomen to reach the prostate. But there is also a laparoscopic retropubic code, so don't think that when it says incision, don't think that it's just an open. You could also do it laparoscopic. And perineal is an incision between the back of the scrotum and the anus, the perineal area. So that's how you would differentiate those codes. I wanted to put this in here. It's not mentioned in the textbook, but it's fairly common, and specifically if you are working in a urology or pediatrics practice. Hypospadias is a birth defect that affects male babies, and the urethra is opening on the underside of the penis instead of at the tip. It's pretty common, easily treatable, and the surgeons correct that. Usually my nephew was born with it, and I think he was about 18 months old when they went in and did that surgery. And the last thing I want to mention in the code book are the codes for intersex surgery. As this becomes more socially acceptable, we may see it more frequently, and I just wanted you to be aware that these codes are in the male genital system section of the CPT book. So now let's look at some of the exercises from your textbook. The first one refers to a subcutaneous abscess on the penis. Remember that subcutaneous, you're going to go back to the integumentary system, and it will give you this code. The next exercise has to do with a vasectomy. And there's the answers for that one. A left inguinal orchiectomy, or removal of testes, is your operative report number 2. And there is the path and the code. Notice that your modifier left is included because the testes are bilateral. The removal of the condylomas, which are genital warts, with the use of cryo. And there's the code. An incision into an abscess of the scrotal wall. There are the answers. Laparoscopic retropubic radical prostatectomy. And there is the code. Removal of an inflatable penile prosthesis. And there's the code. I have not worked very much in trauma, but I know that it is not uncommon for gentlemen to use a penile prosthesis after there's been a traumatic amputation of the penis. And here's the hypospadias repair that I just wanted to talk about a little bit because it is fairly common, and you would be dependent upon the operative report to help you know how to code this. If you have any questions about the male genital system, please post them in the discussion board along with the index path you use to find the code, and I will try to answer them for you. Thank you so much and have a good day.